Hi, this is Gary V. Listen to a Filipino radio experience right here in Las Vegas. PHLV Radio.
Your Filipino radio experience is finally here in Las Vegas.
Nandiyan ka na naman. Tinutukso-tukso ang aking puso.
Get the PHLV radio app from the App Store and Google Play.
Just like a friend from back home.
Hi everyone, this is Lonnie Misalucha and you are listening to PHLV Radio.
PHLV Radio.
The Philippine Nurses Association of Nevada now brings you Filipinars, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Good evening, Filipinars listeners and viewers. Magandang gabi po sa inyong lahat. Thank you so much for joining us tonight, and I hope you had a good week. And as you know, Filipinars is brought to you by the Philippine Nurses Association of Nevada, or PNANV, and of course in collaboration with your favorite radio station, PHLV Radio. We had a seminar last week with the PNANV, and it was looking at the aftermath of COVID. And one of the topics was resiliency. Anyway, resiliency or resilience is a very popular buzzword these days. It's especially in dealing with the COVID pandemic. How do we become resilient in the face of trauma? Why are some people more resilient than others? Well, tonight we are going to explore and look at the results and implications of a research study about resilience among Filipino-American women. We are going to talk about the process of mindfulness in enhancing resilience in the context of trauma and look at the strategies for increasing the nursing resilience amidst the COVID pandemic. And here to talk to us about this very interesting topic is no other than the man who conducted the study himself, Dr. Andrew Thomas Reyes. Welcome,
you.
Dr. Reyes.
Thank you, Doris, for having me today. Yeah.
Of course, we are so glad that you were able to make it today.
Thank you.
Well, to a lot of you, Dr. Andrew Thomas Reyes is not a stranger. His research focuses on the concept and construct of resilience among college students, the military veterans, and Asian American women with history of trauma and post-traumatic stress. He is currently exploring the effects of mindfulness on avoidant behaviors in post-traumatic stress disorders. He's also investigating the cultural factors affecting the trauma among ethnic minority women, right, Doctor? And he specializes in psychiatric mental health nursing, and he is an assistant professor at UNLV, right? And prior to teaching at UNLV, Dr. Reyes was an instructor in psychiatric mental health nursing in many mental health facilities in Canada and also in the Philippines. So thank you so much for that. And do you have anything to add to that?
Oh, thank you very much for having me here, and I'm really happy to share the results of our study. We explored the resilience among Filipino American women, and basically they were women here in Nevada.
That's fantastic. That's fantastic. So can't wait. Anyway, so Dr. Reyes, how do you define resiliency or resilience?
So resilience or resiliency is the ability to thrive, not just survive, but thrive in the midst of adversity or despite adversity, despite challenges. And sometimes we also say the ability to thrive because of adversity. And so the common phrase or definition, part of the definition is having to experience adversity or challenge in life. And so despite of all the challenges, one thrive, and that is what we mean by resilient.
Resilience.
And different people have different levels of resiliency, their ability to cope in the midst of a difficult time. Yeah.
Very good, very good. So as we mentioned earlier, you did a research study on the resilience of Filipino American workers, or was it specific for healthcare workers?
It was more general Filipino American women.
Okay.
And there were a lot of healthcare workers in that study.
In that
as well.
study, okay.
Yeah.
So can you tell us what made you decide to conduct the study, and what was the process on how the study was done?
Okay. So we call that study as a cross-sectional study, which means to say was basically a survey. We distributed survey among Filipino American women within Nevada, mostly here in the Las Vegas area, and we use what we call convenience sampling. Which is usually what we do in a pilot study.
Correct.
We just give survey to people who we come across. It was the ideal way of doing a research is we do a random sample. And so, but we don't, but because it was a pilot study, we just use a convenience sampling. So we distribute a survey to many Filipino American women in the Las Vegas area. And the reason why we did that study was that, we always hear anecdotally that Filipinos are resilient, right?
Yeah.
And so I just want to, and a lot of, researchers who are focusing on Filipino research, Filipino population, they look at the study, cardiovascular diseases of Filipinos. We all know that, among Asians, Filipinos has one of the highest proportion in terms of cardiovascular diseases, high cholesterol, high blood pressure, but not many researchers are focusing on the mental health aspect of research. And so I want to focus more on the mental health of Filipino American women, more particularly about the resilience when in the midst of their trauma.
Okay. Well, what else to equate this to? What was the most recent? What do you call this? The COVID.
Yes.
Yeah, COVID. So we're gonna equate a lot of your research to COVID.
Yes.
So in this study, you also focused on PTSD,
Yes.
or post-traumatic stress disorder, correct? Or an anxiety disorder. How would you define PTSD for our listeners and our viewers?
So PTSD is basically an anxiety disorder, and it is characterized by at least two basic criterion. One should be exposed to a traumatic event, and then they would have these 4 clusters of symptoms. And so I think those are the symptoms of PTSD. There are re-experiencing, intrusive, arousal, avoidance, negative symptoms. So there are 4 groups of symptoms in a PTSD, and then they have to be exposed to a traumatic event. And so the exposure to a traumatic event, it's anything that is traumatic to the person. It could be, somebody was sexually assaulted, even in being in a war, for example, especially for military veterans, or sometimes even, like say with the healthcare workers right now, there has been a lot of traumatic exposure for our nurses when they were taking care of patients with COVID. So that's how we define PTSD. You're exposed to a traumatic event, and then you have these 4 clusters of symptoms.
Yeah, which we're going to show that on screen. You're going to maybe go through a little bit about the
Yeah.
4 cluster symptoms of PTSD?
Yeah.
Yeah,
So the 4 clusters of symptoms of PTSD are first is re-experiencing symptoms, which is about when you actually go back to the time when it feels like you go back to the time when you were initially exposed to a traumatic event. But it doesn't mean to say that you're experiencing the event, re-experiencing the event as with your whole 5 senses, right? Sometimes you're just feeling, let's say you smell something, and then you smell something again, which is the same similar scent when somebody was exposed to a traumatic event. So some examples of re-experiencing symptoms are, nightmares and flashbacks.
It triggers you, that re-experiencing. Okay.
And then there's also the arousal symptoms, which is, like you are hypervigilant. You are on the guard. You're always on the lookout. Okay, where is the nearest exit here? So that in case something happened, I know I'm ready to exit or something like that. So you get startled easily. You have difficulty concentrating. Those are examples of arousal symptoms. And then we have negative symptoms, which are like you're feeling depressed. It's hard for you to have a positive feeling, even you watch the movie, or even you do something that you used to do before that gives you joy. You no longer experience that joy. You used to like watching movies, and you don't do that anymore. These are more like symptoms of like it's almost like symptoms of depression. And then the last cluster of symptoms, we call it the avoidance symptoms, and this is where really the meat of the PTSD symptom, where the more you try to avoid your symptoms, the more your PTSD exacerbate. What I mean by avoid, let's say for example, one was sexually assaulted in a hallway, in a stairwell, for example, and so the person now tries to avoid using the stairwell or going to a dark place, for example, to the point that their limitation become increasingly expanded. For example, and then later on they won't go to an elevator anymore. So the more you try to avoid, and mostly what we mean by avoid is also we call experiential avoidance, which means to say that people with PTSD, they have difficult, when they are triggered, when they remember a traumatic memory, it's really unwanted for them. They don't really want to remember it. And so what they do is they try to suppress it. And when they try to suppress it, the more the symptoms, there is a paradoxical effect. So the more you try to suppress a difficult feeling, an unwanted memory, the more that unwanted memory just kind of,
comes back
to you. It comes back haunting you again.
Yeah.
So and it's the avoidance symptoms of PTSD that makes people more feel sicker.
I see. Wow, that's pretty interesting.
Yeah.
So you mentioned about resiliency and PTSD. So what were the results of the resiliency and PTSD? What were the scores? And I think we can show that on screen as well. And Dr. You can discuss this.
So the cross-sectional survey study we did, we look at the resilience level, their PTSD level, and we did other variables. We call them variables in research. And what we found with resilience is that a lot of them really had a high level of resilience. It's not a surprise to many Filipinos. We had a high level of resilience. So in the screen it says there some have a score of 30 or a score of about 26 or a score of 30. Yes, and so the highest score is 40. So here these scores are actually high. They're considered high or even above the medium level. And so we could see that a lot of our Filipino American women from our sample, they really had a high level of resilience.
Okay, so you studied Philippine American women. that were foreign born, meaning they were born in the Philippines, and also you put in your study those that were born here in the U.S., right?
Yeah, we
Okay.
compared them to, we found that in our sample there were women who were born here and they were born Filipino, born here
okay.
in the Philippines. So we just compared their levels of resilience, and
Wow.
we found that those who were born in the Philippines have a higher level of resilience, and those who were born here in the United States have a lower level of resilience, and yet, but they were still considered a high level of resilience.
Oh, as compared to the other
As
other
compared
people.
to the
Other
as compared to the Filipino born and
okay.
and those born in the United States. We did not compare this with those born from other cultures.
From
as
other
well.
cultures. Oh, okay.
Yeah.
So that's the resiliency. What about the PTSD scores?
Okay. So for the PTSD score, we found that those who were born in the Philippines, the Filipino women who were born in the Philippines, had a lower level of PTSD. But those who were born here in the United States, they have a higher level of PTSD. And then we compared if there was a significant difference. In research, we do a statistical calculation to see if there is if the difference between their PTSD level is significant. And we found that it was significant. So we found that people who were born in the Philippines had lower levels of PTSD than those who were born here.
Okay, we're really intrigued, and I'm sure a lot of our listeners and viewers are intrigued. So, why do you think there is a higher level of resiliency on the foreign-born Filipino American workers rather than the U.S. born, and why is there a lower PTSD score among the those born, the Filipino born, from the U.S. born?
Yeah, that's really interesting. In cultural research, what we call it the healthy immigrant effect. Most people who are immigrants, they come here to the United States, they start to be healthy, and part of that is because we go through a medical exam. When you migrate here to the United States, you go through a medical exam. So basically, the United States accept healthy people, right? And so they pass a medical exam, and so that's one thing there. That's why there's what we call a healthy immigrant effect. But the healthy immigrant effect, once they stay here, they live here. It's interesting. Many research scientists have found that after living here in the United States for about more than 10 years, their health status becomes almost the same as those who are born here in the United States.
Okay.
Yeah. So including mental health and even cardiovascular as well. And so, and it's kind of really hard to, there are different kinds of theories why, but I think one of the theories behind that is that we Filipinos, we have a more closer knit of, we have social support. Social support contributes to your resilience. So when you have a strong family ties, when there is family that support you emotionally, support you, then we also have extended family in the Philippines. And then when we come here, many of us might be coming here by ourselves. We don't have all our families here, and so that kind of contributes to our lower levels of resilience, right? Compared to those who were born here, they were so used to a very traditional nuclear family versus an extended family, and so they don't really have that much social support or emotional support from their families.
Okay.
Yeah.
Okay. I think you call it a cultural portal, right?
Yeah,
But before we go to that, I'm going to throw you a curveball.
Yeah.
Okay. I was talking to my daughter about what we were going to talk about, and she said, "Mom, that's a no-brainer. The people who were born in the Philippines were basically exposed to a more harder way of living, rather than when you're here and born here. It's like you have all the comforts in life." And how true is that?
Yeah, that is really true. And and there are research studies out there too, that Filipinos and all other Asian ethnic minorities also, they're so used to economic hardships, and having that, experiencing that economic hardship really it kind of really bolster our resilience too.
Okay. Okay. That I really truly believe that
Yeah.
too. So you were mentioning about the cultural portals that are available. So can you expound more
Yeah.
about that?
So when
and
we
I
say-
think we have a couple of things that we can flash on screen about that too.
Okay.
So,
Yeah, so when I say cultural portals, these are kind of resources and sources of enhancing or improving one's resilience. And, there are parts of our culture, especially Filipino culture, that kind of really improve our resilience. One is the community support and the family support. Even here in America, for example, our families, there are, we build our families, may not be blood relatives,
Right.
and then we consider them as families. And many communities here in the United States, they have their own fiesta, they have their own community. A certain city, for example, would have their own association. A certain province from the Philippines would have their association here in the United States. And those are kind of community support. And of course, we have also nurses associations as well, like PNANV. Those are kind of social support that helps enhance our resilience. So so those are parts of our culture that improve our resilience. And then there's another part of our culture, we are like the television and the social media as well.
Right.
Those are another resource of our resilience. If you're going to, watch the Filipino channel or the GMA, I'm not
Or
trying to-
PHLV
or
radio.
PHLV radio. If you're
Yeah.
gonna watch the soap opera, the movies, the most of the theme that they talk about is about resilience. Families are going through a difficult time, they're experiencing economic hardships, and even despite of their economic hardship, they still are able to achieve education within their family. Their families are still able to go to college, for example, or despite a significant illness in their family, they are there to support each other. And this is a common theme among the television and the movies. And even if if you go to YouTube, for example, some foreigners like Americans and British and Australians, they create these YouTube videos about traveling to the Philippines, and one of the most common thing they comment about the Filipinos is that they are resilient. So I think it's part of it's already kind of, yes, you've said a while ago, it's a buzzword, and I think it's a very common characteristic for it's a best way to describe us Filipinos. We're resilient, and so we hear that all the time, and those constant message over the television and social media again, contribute to our resilience as well.
Basically, big family, even though you're not related, everybody's an aunt, an uncle, and a niece, and, and a cousin, or it's really cool, and it boggles the mind of a lot of cultures, for that, especially here in America. She's your aunt? Really? Okay. So are you your mom and you're his dad? Are you brothers, sisters, or what? No, it's not that way. So we have extended family.
So I think that's one message that I would like to impart to the audience, to the listeners, is that let us not forget to really kind of really cherish our culture as well. I know there's part of our culture as Filipinos that we are not really proud of. Like when we were when we were elementary, for example, we were learning about different values of Filipinos, like bahala na value, the ningas kugon na value, right? But I think most of our cultural values as Filipinos are actually on the positive side, which actually support our resilience, like our strong family ties
and caring for each other.
And caring for each other.
Okay. Oh, very good, very good. So let's talk a little bit about PTSD, COVID, and the nurse.
Yes.
And you, in your study, you mentioned, some statistics, which I'm going to mention, and then I'd like you to comment. And we'll flash these results on screen as well. So in the results of the study, it says up to 42% of nurses working in hospitals that provide care to COVID-19 patients have developed, actually, PTSD. Nurses from non-COVID clinical areas also have developed PTSD during the pandemic. And there is a higher prevalence of nurses developing delayed onset of PTSD, and it's predicted that this is going to happen for months and years to come. And that nurses, of course, will still be continue to be exposed in this. But the most interesting thing is among Filipino nurses is 4% of the U.S. nursing workforce are Filipinos,
Yes.
right? And 31.5% of the nursing workforce of COVID-19 deaths are Filipino nurses. So can you comment about these statistics?
Yeah.
And why do you think there's a higher percentage of deaths among Filipino nurses in the total workforce?
It's kind of I mean, this statistics was not a research study, but it was more like, they collect all this data from the from the different nursing boards and how many are Filipinos among the nurses in the United States, and then they also when the U.S. Census also I'm not sure if it's a U.S. Census, but the government will collect data as well. How many deaths were there related to COVID?
Right.
They will also collect the ethnicity, the ethnic background of those who died, and they found that many of these nurses, and it's really a very appalling statistic.
Right.
I mean, about only 4% among the nurses in the United States are represented as Filipinos, but this data was an early data. This was from last year. So about 31% of those who died of COVID-19 from our Filipino nurses as well, from the nursing workforce. Those who died, all the nurses that died related to COVID, 31% were Filipinos.
Yeah, that's...
I'm not really sure why there's a lot of Filipinos, but I think, we could see that most of the frontliners, most of our Filipino nurses are frontliners.
Right.
And so, they were the first people to respond, and they were the first people to respond as well when we don't really know a lot about the COVID-19 at that time as well. So it's really telling to us as well that most of our Filipino nursing workforce are mostly frontliners, right? And so for example, for me, I'm not really a frontliner. I'm more of an educator, but and this is, we could just see that a lot of our nurses right now who are Filipinos are frontliners, and that's why probably that's one of the reasons.
Yeah, I was kind of thinking about that. A lot of Filipino nurses are also opt to go to the ICUs, to work in the ICUs, the more critical units in the hospital, and so you're thrown everything but the kitchen sink in those types of situations. So so it's really like you said, appalling, but it's pretty interesting, statistics actually. So
and then regarding the other statistics related earlier, so taking care of patients of COVID-19 can be a traumatic event for someone. Just imagine, for example, you're taking care of a patient with COVID-19, and they're not allowed to visit. They're not allowed to have their family at that time. Their families could not visit them. That is pretty much traumatic for the nurse. And then there are, their colleagues as well, their nursing colleagues too, who have died of COVID-19 as well. That is also traumatic. Just like a military veteran, they go to the war in Afghanistan. Usually they come in buddies, and then the other person died in the war field, and then the other survived. So we have what we call survivor's guilt in PTSD, and so this is a part of that. Is as well, there are a lot of nurses experiencing survivor's guilt. They see their closest colleagues have died of COVID-19. And then just seeing a lot of deaths every day, on a sudden death like that, it's not like, somebody dying of cancer and it's just, there is a process when they die. It's a progression of, somebody dying. It's a dying process. But this one, it is a dying process, but they die much more quickly, and they die. There's a lot of they see a lot of deaths every day. You know, every day and every day, it was just traumatic for them.
Yeah.
And so that's why we
Right.
see a lot of nurses who have developed PTSD. Even those who were not taking care of COVID-19 patients, they were also developing PTSD.
Yeah.
Because
Yeah.
part of PTSD is that the traumatic event that you experience may not necessarily something that you directly experience.
Correct.
So even if you hear something, people, one example of traumatic exposure is direct exposure. Somebody was sexually assaulted by somebody, right? Another one is you just hear somebody, you hear a news about a traumatic event. Let's say someone heard his cousin died of suicide. That can be a traumatic event. So even just by hearing a news about something, it could also cause a traumatic, can also cause trauma
on you.
on the person. Yeah.
You're very right about that.
Yeah.
Okay, so we know that we're not over this yet, but I'm
Yeah.
pretty hopeful that we are going to get over this. So it's going to be a continuing effect. So what would be some of your proposed solutions
Okay.
to increase resiliency among, healthcare workers or even the public?
Yeah.
Yeah.
So, so for Filipinos, for example, just like I mentioned, we have these cultural portals.
Correct.
There are parts of our culture that will really kind of support our resilience. So, kind of really go back, and cherish your treasure. Cherish your culture.
Your roots, yeah.
Roots. Your family. The other thing, we are in the process right now of conducting another research study, and we are developing a mindfulness intervention, which is a mobile app, and these are for nurses
Yeah.
who've been traumatized by COVID. And this app is based on mindfulness, and there are mindfulness is another buzzword as well. There are a lot of research scientists
Right.
that are now focusing on mindfulness, and we found that mindfulness helps support one's resilience. It also reduces PTSD.
That's so, I'm intrigued by the app. So
Yeah,
that's really cool because at least it will guide you. And again, like you said, mindfulness is another buzzword.
Yeah.
You're saying be mindful of yourself, be
Yeah.
mindful of others. So I think that would help out, a lot.
Yeah, because the mechanism of mindfulness, as I've said a while ago, was that avoidance is one of the exacerbating factor of PTSD. So many people with PTSD, they don't want to feel, whenever they are triggered, when they ever remember an unwanted memory, a traumatic memory, what they do is they try to suppress that difficult feeling. And it is very understandable because it is really very painful. When somebody, if, let's say, for example, somebody was, a nurse, for example, taking care of COVID, and then all of a sudden she remembers her colleague who died of COVID, for
Right.
example. So for them, it's a really emotionally painful feeling, and they don't want to feel that pain, and it is very understandable. So some people will drink alcohol to numb their feelings. So the more you try to suppress or avoid your traumatic memories, for example, the more that the PTSD becomes more severe. With mindfulness, instead of trying to avoid it, it's not like you're confronting it, you're just being present. You become present with that difficult feeling without any judgment. That it is just a thought that comes into your presence, and then another thought will come.
Yeah. That's pretty cool.
Yeah.
So this whole COVID pandemic has really taken a toll on our mental health. It's a big impact on our mental health.
Yeah.
So how can we cope with the mental health impact of COVID? What would be your advice to the healthcare workers and maybe the public as well?
So that's really true, Doris, that the COVID-19 has really caused a lot of trauma and also depression. There is different mental health effects with the COVID-19. So not only with the physical, the physiological, the breathing, but also the mental health.
Burnout.
Mhm.
Yeah.
And so
Yeah.
so some of the things I would suggest when in the midst of this difficult time is to stay connected with people. As I've said, social support contributes to enhancing or improving one's resilience, and resilience is also kind of really reduces your some of those traumatic effects of COVID-19. And so stay connected with people, and I know some people don't like me to say this, but limit your access to news. So it's okay to watch the news, but I think you should not spend your whole day watching the news.
Over and over again, same thing said over and over.
There was actually a study in California where they compared in the Boston Marathon shooting, where they found that those who were watching the news about the Boston Marathon shooting, there were more people who developed PTSD just from watching the news versus those who were actually in the marathon.
Actually in the marathon.
Okay.
Wow. What a, that blows somebody's mind.
Yeah. Mhm.
So that's good.
And then, and then maintain or establish a regular routine. Like me, for example, because of during the COVID and because of the COVID-19 pandemic, I started going walking every morning at the park. Because I wasn't able to go to the gym.
Right.
So, and just establish a regular, healthy routine, and it kind of gives you a sense of purpose. A daily sense of purpose. And
that's good.
It will help with your coping with the difficult impact of COVID-19.
Very good, very good.
And then, we also encourage people to, call if they feel they're feeling, distressed. There are 1-800 numbers to call for help. It's something that we strongly encourage is that don't wait until it's really too late. Especially Filipinos, for example, we tend to really stigmatize mental illness, and we don't really want to share it to people, what we're experiencing within our families. And so, and this is one of the reasons why I did the research on Filipino American women, is to, campaign for being more comfortable about our mental health issues, our psychological difficulties. We are so comfortable talking about our physical illness, but we still are hesitant to share to the public about our mental health issues.
Very, very true. And that's one thing that we as a culture need to improve upon. So, boy, I tell you, I can say, this was very, very interesting, and thank you so much, Dr. Reyes,
you're
for
welcome.
coming to the program, for gracing our program tonight. It was a very interesting study that you actually conducted. The results are very eye-opening, and I'm looking forward to that mobile app.
Yes.
So you will have to come back, the mobile app on mindfulness, and you'll have to come back and talk about it when you get ready to launch it.
Yeah.
Okay? All right, very good. So, and to our viewers and listeners, we leave you with this. Yeah, we're not over the COVID pandemic yet. This will continue to affect our mental health, whether we are healthcare workers or not. And please heed the advice of Dr. Reyes. Let us practice mindfulness and reach out to someone if you need help. Please continue to stay safe out there, and let us work together to protect each other. Thank you so much for joining us tonight. Thank you for giving us the privilege of your time. This is Doris Bauer, your Philippine Nurse host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine Nars, news and features about the Filipino American nursing community and beyond on PHLV Radio.
This is your Filipino radio experience in Las Vegas. PHLV Radio.
PHLV Radio.
Hi, this is Gary V. Listen to a Filipino radio experience right here in Las Vegas. PHLV Radio.
Your Filipino radio experience is finally here in Las Vegas.
Nandiyan ka na naman. Tinutukso-tukso ang aking puso.
Get the PHLV radio app from the App Store and Google Play.
Just like a friend from back home.
Hi everyone, this is Lonnie Salucha and you are listening to PHLV.